Up next, a Biden official exposed for trying to get rid of age restrictions on trans surgeries for kids.
We honor the many contributions transgender Americans make in health, medicine, public service, and across our nation. At the Department of Health and Human Services, our mission is to improve the health and well-being of all Americans, including transgender Americans.
The health and well-being of all Americans? Right. Well, we're learning now that the Biden HHS officials actually pressured a health organization to remove age guidance for transgender surgeries and treatments for kids. Here's how one conversation went with Rachel Levine's chief of staff. Rachel, this is a quote, Rachel is confident, based on the rhetoric she is hearing in D.C. and from what we've already seen, that these specific listings of ages under 18 will result in devastating legislation for trans care. She wonders if the specific ages can be taken out. But wait, here's another email that states Levine, quote, was very concerned that having ages, mainly for surgery, will affect access to health care for trans youth and maybe adults too. Apparently, the situation in the USA is terrible, and Rachel and the Biden administration are worried that having ages in the document will make matters worse. She has asked us to remove them. Dr. Peter McCullough joins me now. Dr. McCullough. I know, I'm shaking my head too, Doctor. The draft guidelines released in late 2021 recommended lowering the age minimums to 14 for hormonal treatments, 15 for mastectomies, 16 for breast augmentation or facial surgeries, and all that was eliminated in the final guidelines. A blatant example of the Biden administration putting politics and ideology above the safety and health of our children.
Levine, who's a man, has made the adult choice to live out his life as a woman. It's a fantasy that he is experiencing. He doesn't have the right to push his ideology and endanger American children. The puberty blockers and hormones in surgery are permanent. They're disfiguring, sterilizing, and the entire package of transgender care increases the burden of psychiatric disease and increases mortality.
And the sad part about this is that Admiral Levine, who's a woman now, says she has no regrets about transitioning. But take a listen.
I have no regrets. I have no regrets. Because if I transitioned when I was young, I wouldn't have my children. Mm-hmm. I can't imagine a life without my children. And so every experience led me to here. And so how could I regret that?
So he didn't do it as a child, but Dr. McCullough, children today aren't so lucky. How do these gender-affirming care treatments impact fertility?
They're almost always sterilizing, even a month of Lupron, the puberty blocker, and then the androgens and estrogens. The surgeries, the mastectomies, are complicated with need for surgical revision, trouble with drainage. The genital surgery is nothing short of horrific. In the men, the penile inversion vaginoplasty is performed. That causes all kinds of urologic problems. And then the women, phalloplasty and metoidoplasty are, distort the female genitalia. This can't be reversed. Many have regrets later on. And sadly, the children who have the greatest proclivity for doing this, Jeanine, they have autism spectrum disorder. So they don't have any ability to understand what they're getting into.
And you know, Dr. McCullough, the White House told us that they do not support surgery for minors, but they have no problem advocating for gender-affirming care. Take a listen.
Gender-affirming care is life-saving, age-appropriate, and a critical tool for healthcare providers.
Do you think states should have a right to ban gender-affirming health care? I don't think any state or anybody should have the right to do that. Sometimes they try to block you from being able to access certain medicines, being able to access certain procedures. What they're trying to do to trans persons is immoral.
Dr. McCullough, Biden says these bans are immoral. Your reaction?
The jury is out on what's really going to happen to these individuals over time. 25 states have stepped in because the doctors and hospitals can't police themselves on this, and they've banned or restricted transgender care. Now the Biden administration this week is going to take a case, and the Supreme Court has accepted it, to actually overturn a Tennessee ban on transgender care. So this is going to be decided at the level of the Supreme Court. I can tell you, as a practicing doctor, I do not think transgender medicine is safe, effective, and I'm extremely disturbed that it increases the burden of psychiatric illness and mortality.
Dr. McCullough, thanks so much for joining us tonight.